Hi, Medgadget. Shiv Gaglani here. I'm with our very own Surgeon General, Dr. Regina Benjamin. Thank you for joining us, Dr. Benjamin.
Thank you.
You gave a great talk about the need to improve physical activity among our youth, and I would like to show you what we've been doing here at TEDMED too, with the smartphone physical. And obviously you've been a doctor for some time, and you've done many physicals a long time. I won't ask how long.
23 years in solo practice before I came here.
Okay, wow. Wow. And I'm sure you've done hundreds of thousands of physicals.
Yeah, I was the only doctor in the town for a while.
Really? Yeah. So you were doing tons of them.
Doctor.
Primary care. And so these are actually gadgets that I think could help with primary care physicians and help them get more data and help their patients get data as well. And so I have 3 of them that I'd like to show you because even though you've done thousands of physicals, I'm not sure if you've ever done a physical like this with these data. Sure. So we have, the first thing is called a cellscope, and it's it's an otoscope that essentially attaches to an iPhone 5.
Oh.
And so if you don't mind holding this for me, I can attach a tip.
So you just put the tip and put this into the iPhone?
Yeah, so it uses
it's kind of neat.
pull out where the tips are. It uses the flash from the iPhone to generate the
light.
light.
To see?
Yep. And so all it takes is put a new tip on for you. So you're primary care, so you did a lot of
Family physician.
Family physician, so you did kids all the time.
All the time.
Great. And so that's somebody else's eardrum right now, but I'll navigate to do a new exam. Okay. And do you mind if I do your right ear?
Okay, you want me to do yours?
You can do mine. Sure. Okay. I guess you have more experience, so.
So I hit it just like an iPhone?
Yeah, so
take the picture?
just take the picture. You can type anywhere on the screen.
Okay.
Okay.
Oh, anyway,
Make sure
it doesn't have to be by the camera.
Yeah, you can touch it. Yeah.
Okay.
I should have Q-tip before this.
That's okay. But what I'm trying to do with your picture, there we go.
Got it?
Like
an expert. The first time you've done it. Yeah. So let's see. So, yep, right there, the eardrum.
Yep,
Back.
it's in there. I can see it. Well, barely.
Barely. I could turn on the light, yeah. So that's very easy, obviously. If you want to try this, you can do this on me too. It's the ophthalmoscope. And so this is a little different. We'll turn on the ophthalmoscope app. And so it just uses the camera, again, on the iPhone 4. And I'll focus it for you. There. And turn on the light. And so you're welcome to just help guide it because I've done this so many times.
Still haven't run into this. Let's see, I've lost your. There we go.
And obviously my eye is not dilated, so you
No.
probably will just see the back.
I see the back. I can see it pretty well.
You can take a picture and then
It's not as good a picture as you saw the other one.
that's fine.
You want to do mine?
Sure. Try it on you. Do you mind holding this?
Bring it closer, huh?
Yeah.
I probably wasn't
I'll bring it
close
close.
enough.
I had a cup on it, but it disappeared for now. But yeah, if you just look over my shoulder. There it is. Yeah, and again, undilated eye, so I only get a little. I can take a picture regardless. But yeah, no, it's very cool because as a primary care doctor, you realize that.
Yeah, I could. Let's see it. Did you take a picture?
I did. It wasn't very small.
Yeah, because yours are small. I could see it, but I could see the.
You see the optic disc? And so as a primary care doc, you realize that the benefit of this is that you don't just look at somebody's eye and say, unremarkable or WNL within normal limits. Here you can actually get a baseline image. And the last one that I'll show you is this case, another case for an iPhone 4. If you just hold it like this, we can get your EKG. It's a 1 lead, so lead 1. Yeah, and so.
You have to put it on the camera.
Yeah, the phone. So it'll transmit actually. You don't have to attach it.
Oh, you don't have
transmit.
to?
Yeah.
That's pretty neat.
It's very neat because it actually takes your electrical activity, converts it into a sound wave, and then transmits it to the phone. So here it is. You're very. Yeah, so it's very easy. Obviously, patients can maybe use this and get their own reads as an event monitor.
That's pretty neat.
You
That's
like it?
Better than asystole, though.
Yeah, so we think it's really cool.
Wow, that's pretty neat.
So what did you think? Would you think when you go back to practice, would you adopt any
I'm
of
going to ask
these?
you this question people always ask me.
Sure.
Is it affordable?
Is it?
Especially for someone like me who is in a small practice and most of my patients work for a living, so they didn't have insurance and they didn't have Medicaid because they work.
Right.
So it's out of their pocket. So how affordable are these?
So this is $199, and so it's pretty affordable for somebody who wants to monitor like long QT or atrial fibrillation. But hopefully, as sensors get more cheaper and as smartphones become more ubiquitous, the cost will go down. So I hope.
So this is $199. What about the others?
So this is for for physicians to use. The ophthalmoscope itself is a couple $100, but that's a physician thing. The case is, I think it's a little high. It's $149, but I think it'll still go down. And then the cell scope, again, for physician use, it's not priced yet. These two are FDA approved. This one's not FDA approved yet. Okay. But maybe you can talk to somebody at the FDA and help that happen.
I'm sure they're working on it.
Yeah.
So those are actually pretty good, because just to think about what they actually cost,
right.
Ophthalmoscope, these kind of are much higher, much more expensive.
Right. And so my last question for you, though, is you have such a great platform, and I'm really appreciative of what you're doing as a medical student to promote health among the nation. What do you think is the main priority now for the next few years that our president is in office?
Well, the president's very supportive of prevention, and so we have an entire prevention initiative, the National Prevention Strategy. So we want to prevent people from getting sick in the first place, and our goal is to change our healthcare system from a system based on sickness and disease to one based on health and wellness. Right. And the objective is basically to increase the number of Americans who are healthy at every stage of life. And so we have an entire program around that. That was part of the Affordable Care Act, to create the National Prevention Council, out of which came the National Prevention Strategy.
Great. Well, this is the third time I've seen you, second time at TEDMED, and I saw you at the AMA conference promoting, helping medical students out, so I appreciate your time.
And medical students are the folks who are going to be treating me in a few years and treating the rest of us. But it is, wonderful to see that this health and wellness, and this wellness and prevention is taking a stick to young physicians, and the young physicians understand the importance of preventing people from getting sick in the first place and having a more healthy and fit nation. So it's great.
Definitely. Well, for Medgadget, thank you very much, Dr. Benjamin. It was a pleasure talking to you.
So this is great. And anything that can make our life easier to treat patients and make it easier to care for them better, that's really what we're all about.
Thank you.
And thank you.